It's not always the smartest thing to do when you start a talk to start nitpicking your title of your talk, but that's how I think we're going to start tonight. Here, the title is Unveiling Potential, Raising Independent Children with Spina Bifida, and that's a perfectly good title, and there's really no reason why I should start picking on it. But I do want to talk about that word independent. And as Julia and Ruth and I were talking about this, we started to wonder, like, is independent really what we're shooting for here? And ultimately, is anyone truly independent? And that word to me connotates that, you're not dependent upon other people. You can kind of act for yourself and you're your own agent and you don't need other people around you. And I think the reality of the situation really is that if you switch the slide one more, advance one more, I think it's probably healthier to think that we are interdependent upon each other. As a parent, I need the school teacher to really do their job to educate my kids so that I don't have to take that on. I need my coworkers to do their job so that I can get my job done. And that's ultimately how things work the best is when we have trusted relationships and we can work with each other. So, we will use the word independent, but I don't want to glamorize this idea of not needing other people. In fact, we all need other people. And so that's something really important to keep in mind here. So, and I honestly, I probably can't tell you the nuances or the differences between the words self-direction and self-determination. Maybe somebody else, kind of knows that. But I think this is ultimately what we're shooting for, right? Is we want individuals with spina bifida to grow up to be self-directed and to exercise self-determination. And I just pulled some definitions off the internet here, but self-direction, one of the definitions was just making your own decisions and organizing your own work rather than being told what to do by others. That doesn't mean that you don't rely upon others or interact with each other or even really depend upon each other's, but you're really directing your own work and you have goals and objectives that you are pursuing. Self-determination to me feels about the same. Autonomy, that might be a little much. I probably should have cut that word out of here. Self-rule sounds a little much. But ultimately that is what I think we're looking for is we want kids with spina bifida to grow up to be self-directed and exercise self-determination. Julia, any thoughts?
I was just going to say, I think it is really important to emphasize that sort of self-direction as opposed to complete independence is really important. I've learned that throughout, my teenage years versus, now being almost 30. It's really, really eye-opening to see that we all really do just depend on each other and we do need each other to a certain extent. And in certain circumstances, it might not be the best thing to say that, we're truly independent and we don't need other people because that in most cases is not true.
And so, as Julia and Ruth and I kind of talked about this presentation, we were kind of brainstorming and we've talked about this over this last weekend is, the question arises is why is self-direction hard to develop in spina bifida? Why doesn't it just develop naturally? And, one of the things that came to mind was the idea of expectations. And oftentimes expectations can be set too low to really build independence. Oh, there I go with independence, with self-direction and self-determination. And before we go too far with this, I want to say that in no way are we in trying to suggest that people aren't doing, working hard or doing everything they need to do as parents or that anyone is doing anything wrong. But what we do want to kind of talk about is the idea that sometimes it's just easier to sometimes do things for people with spina bifida than to expect them to do that themselves. And one of the examples that I've heard before is getting dressed in the morning when there's like 5 minutes before you got to get out the door. Sometimes a parent will say, look, I'm just going to get you dressed and you can work on dressing on the weekend or something. If we let you do all the cathing at this point, it'll just take too long. I'm just going to take care of this. But we do ultimately want to be intentional about the expectations that we set because ultimately that's really part of how you learn and how you become self-directed and how you can do those things for yourself so that you're cleared up to do other things that you want to do. A child with spina bifida who knows how to do their own self-cathing can, go to a sleepover that they want to go to and can participate in those kind of activities. So again, please don't hear us saying that people aren't setting a high enough expectation or that anyone's doing anything wrong. But we want to be intentional about this, about setting expectations that really develop those self-reliance and self-determination skills.
I will say that I can remember as a mom and as a while as a single mom. So I'm feeling this in the morning, you've got to get yourself put together. We've got to get to school, or we need to do XYZ. And I can also remember saying to myself at the time that comprehensively, this meaning the self-direction or the self-efficacy of Julia is really going to be tied into like what I looked at as the long game. So that if I gave in to those moments of really like taking the path that was of least resistance, that wasn't going to be good necessarily for the long game. That's not to say that I never, rushed through a task because I had to, but there were times where I would say to myself in my head, like, no, we just have to ride this out. Or if Julia or one of the other kids would say, oh, we're going to be late for something, I would say, yes, we're going to be late. That's okay.
Sort of going off that theme as well, it's interesting because I think a lot of what we talked about when we were planning this session was sort of how the experience of a person with spina bifida also sometimes does mirror just a person, without spina bifida. Sometimes we all run late. We all run out the door without our lunch in the morning and things like that. So I think it's important to drive home that although this session is spina bifida specific, we all have things that, just go awry. And sometimes that just has to be okay. And we learn to run with it.
I actually I looked at the chat and I'm going to drop in a comment from Ken here who says 80 years ago my mom was told by the doctors if he falls let him figure out how to get up, and that has helped me throughout my life. What do you think of that comment, Ruth?
Oh, I just have a big smile on my face because I think that's exactly right. It's unpleasant to fall, but sometimes we learn through experience and reflecting on experience, and we have to embrace that to the to the extent that we're comfortable. So thank you for sharing that.
Here's another thing that kind of came to mind, that in life, individuals with spina bifida oftentimes encounter barriers that society has, maybe probably not intentionally, but has unintentionally or indirectly created. And those of you who have been to talks that I've given before, I will oftentimes show this. On the left-hand side, you can see this is a magazine cover from a magazine in Berkeley, California in the 1950s. And at the time, if you were in a wheelchair in Berkeley, you were handicapped because you couldn't get onto the sidewalk if you wanted to go to a store or a theater. You were dependent upon someone else pushing you up there and getting you up. On the right-hand side of the screen here, you see these are some real, awesome disability rights advocates who literally went to the street, and you can see the gentleman there holding a hammer, and he's literally breaking up the curb. And this group is intending to pour their own curb cuts so that they can access Berkeley, California, which I just find really inspiring. And, when you put a curb cut in, it's good for everybody, not just people with wheelchairs. But I do think that is one of that can be a limiting factor on self-direction, right? So if you can't access something, or you can't be it a website or be it a building or whatever it is, that certainly can disrupt your ability to direct your own activities and your own life. And sometimes you have to go around to the back of the school because that's the only accessible entrance, right? Instead of going through the front. And it's great to have accessibility, but that can interrupt things as well.
A lot of the challenges for people with spina bifida with self-direction stem from, in a lot of cases, I'm not saying every case, but executive functioning difficulties. And for me, when I started working, a big part of that was, okay, nobody's telling you what to do, what the steps are to completing your job anymore. You're sort of put into the mix and expected to, be able to figure out, okay, first you're going to do this, and then you're going to take this person back to a room. And then, so it's sort of, you sort of have to figure out, okay, nobody is telling me what to do anymore. And that can be a little startling for a second in my experience, honestly. So you sort of have to learn what to do with that and just sort of run with it until you can create your own routine for your workplace that works for you and allows you to get your job completed.
Um, one thing that I always like to highlight is that people with spina bifida just honestly have more things that they're required to do than the typical person on the street. You without physiologic cues sometimes have to just stop what you're doing and remember to self-catheterize yourself 4 or 5 times a day. Maybe take an hour or two and do a bowel program every couple of days. If you have AFOs, you have to intentionally watch for pressure sores to make sure that you don't have skin breakdown, or maybe you have to do wheelchair push-ups, or maybe just even like the burden of like having to monitor physical symptoms like headaches. If I get a headache, I'm not going right to the concern about a shunt failure, but that is something like headaches are something that you have to monitor if you have spina bifida and think about it. So I think it's really important to recognize that the people with spina bifida have way more that they're expected to do, and that can take time away from or even interrupt the continuity or their momentum of some of the things that they want to do. You just get started on something and then you have to stop it so that you can, do your capping. So I think that's something that we want to always have in mind.
I think too, to add to that, that sometimes these different things can, as a mom, I often felt like, oh, how do I infuse more joy? Because I recognize that sometimes it could be a real bummer that Julia had to do all of these different things and other things on top of it. So creating intentional space for like humor, that was a great strategy. Julia has the best and most dry sense of humor. And sometimes also just like even in like a really tough medical situation or dealing with shunt malfunctions and so forth, trying to, even though they're bad situations, trying to find a bit of positive, any positivity that you can find in the situation, and really to make time for games and play and things like that deliberately as part of your daily routine. Those were really important for our family.
I do. Yeah, we would frequently have, family game nights or movie nights, things like that, just so that we can sort of come back together as a family, at night after school, when everybody's been gone all day, just to sort of relax and spend time together, and that was always nice.
That's great. That's great. And so not letting these things really interrupt, is that kind of what you're getting at too, Ruth, is like being intentional and maybe these things interrupt activities, but planning activities in a way that, they can still occur and still have fun.
Yeah, and sometimes when you don't have a choice, right? Like when you're in the hospital, like Julia was in third grade, she had a shunt infection and she was in for a couple months, and trying to really like bring that joy and that humor and like these little things we would find to like just hold on to, as like it was almost like a silent way of communicating funny jokes and things, because it sustains you through these things that are interrupters that you don't really want to be, but you don't have a choice.
Whenever I talk about, as a neuropsychologist, we love to talk about executive functioning. Before I do, especially in the context of spina bifida, I always want to talk about how there are just more things to do with spina bifida because, if I had to stop and self-cath 4 or 5 times a day, or if I had to do a lot of these things that are just medical self-management responsibilities, I would forget. I would look forgetful. I would look disorganized. And, it would I like to say that it puts an additional executive function burden upon people with spina bifida because they have more that they have to remember to do. So with that said, there is some evidence to suggest that individuals with spina bifida, because of the brain impact, can have symptoms of executive dysfunction. And hopefully a lot of you have heard about that or kind of are familiar with the concept. But some of the ways that it's probably most pronounced among the people that I've met with spina bifida include initiation. So just getting started on something. I've heard that from teachers where they say, sometimes, I can explain it and the person knows what they need to do, but I still need to go over and tell them to get started. Or, getting started can be a bit of a problem. Organization can be an issue sometimes, and, remembering all the things you have to remember, but also just kind of getting through the routine of life. Sometimes that can be somewhat overwhelming because of symptoms of executive dysfunction, and even the concept of working memory, or I like to think of it as like things that I have to remember to do or things that I have to remember. If you have to stop what you're doing and remember all these things, that can be difficult. And one of the things that I think is really impactful is, to have an organizational approach and have, some interventions to help with that. And I think that's coming up in the chat here a little bit. And we'll talk about how you can address that as a person with spina bifida, how you can address that as a parent of someone with spina bifida, and even as a provider for someone with spina bifida. But
I think for me, when it came to all that, it was really important for me to take ownership of it as soon as I realized sort of what my challenges were going to be. And I say that because I was sort of in the phase where I wasn't so keen on, my parents sort of doing a lot of things for me and really wanted to do everything myself. And although I realize at this point that that's just not possible, as we're saying, you do need help with certain things, that, you know, taking control of your own sort of well-being and self-care actually feels really good, as opposed to, needing constant reminders and things like that. So once I was able to internalize what the strategies were that I was supposed to be using for managing all that, and I was at a place where I was able to start using them, a lot of things got better, and I think that's very important. I think for initiation, one of the biggest things was when I was doing something, I like to think of it as empty space in my brain, and when I knew that there was sort of empty space where just nothing was going on, I would look at what I was doing or look at people around me and say, "Okay, like, what is everybody else doing? Like, what is the task that is, being started right now, and what do I need to do to start that task?" Unless because personally I have difficulty with math, that was always difficult for me. So that was one of the things that I didn't like to initiate myself. That's also a big part of it is, the preferences of the task that's being initiated, I think.
mm,
So it really just depends the strategies you use based on what the task is, in my opinion.
I remember that well, and it could be challenging also to being okay with saying, for example, okay, well, we've had a talk, you know that you need to do X. If you don't do X, what do you anticipate might happen? And, sometimes Julia would give you a very sophisticated answer, but wouldn't initiate the task. And then, you'd circle back to it. And unfortunately, like some of these things are pretty serious. Like if you don't follow the procedure that you're supposed to for cathing, or if you're not cleaning properly or whatever, there are a lot of examples, but well, you could get sick. You can get sick even if you are doing that right, but some of these things are higher risk. And I think, unfortunately, letting Julia have a few instances, like there was an instance with a pressure sore that got pretty bad. And I think that was a huge learning lesson for both of us, how to navigate that. And like, at what point did I have to step in? And at what point was I letting her kind of learn, like, okay, you're not following, you're not initiating the approach that the doctor has, prescribed. What is the consequence? And then it was the reality of those consequences setting in, that I think you do that a couple times through different experiences. And I have seen like a 180. Now Julia's like the most responsible adult. And so I guess at some point it came back. Continue to present opportunities for responsibility, but also sometimes, I don't want to say demand it, but there was a strictness, I think, to my parenting, or a rigor that maybe wouldn't have been what the neuropsychologist would have recommended. I'm not sure, but I can remember meeting with the neuropsychologist, who I have very warm affection for, but I can remember thinking like, okay, I'm going to listen to what they're saying, and I'm going to internalize it and find my truth in what they're saying. Like, that makes sense. That I'm not so sure applies to Julia. And so I was constantly taking in information, but then I guess to say, to not be afraid to make your own, like form your own truth and your own judgments, using the wisdom, of course, of everybody else, especially the experts around you, but and then kind of work with that to see if that can help get you any further than just, taking the script.
If I could just actually touch on this for a second as well,
Yeah.
based on the question that you received, I think it's important to realize too that at a certain age, the child realizes that these strategies and advice is coming from a third party. And although they do want the best for them, that's not the thing that they want in their lives at that point, which is tough because, again, they mean the best for them and they do want them to thrive. But one of the reasons that, at least in my experience, they may not be so in tune with following those routines and doing those things at this point in time is because they know that they're different and they know that this advice is coming from someone that's trying to help them medically, and that might not be what they're about at this point. So it might be just, I'm not saying completely back off and, allow them to not do what they have to do, medically or anything like that, because, that absolutely has to be done. But there may be some things that, in a very loving way, the parent is trying to enforce the routines or whatever it is to something that may not be completely and utterly, necessary to the daily routine. And that might be something that's okay to back off of for a little bit, just to give some breathing room for the child to realize that no, like it is okay to use these strategies because in the end, it's going to help you. And using the strategies and routines isn't going to have to be called out so much as time goes on, because you're just going to internalize, well, in a lot of cases, you'll internalize them and be able to use them more automatically.
This is just a real short slide, but essentially, you know, we're interested in what can you do to raise a self-directed child with spina bifida, and there's roles for different people. So why don't we advance it one more time, and I'll turn things over to Ruth.
I'll say that parenting any child, I have 3 children. So parenting any child is the hardest job that I've ever done. And then when you parent a child with spina bifida, there's some layers or differences. So I think the best advice I could give is learning to be comfortable. I'll start with the last, with ambiguity, because all of the examples that I'm going to go through really quick are tie back to, there isn't a solution per se, or that the solution for one person with spina bifida might not be the same as the solution for the next person. But having said that, be protective here, it says, of your child with spina bifida while also giving them opportunities to make choices. And I can remember a few examples when Julia was in kindergarten. I came into her class, and there were a bunch of kids playing. It was a parent day, and Julia had an accident, a bowel accident, and one of the children was, he was a kindergartner. He didn't mean any harm or ill will, but he's like, "Oh, I don't want to be around her. Like, she smells. I'm not going to play with her." And that, for me as a parent, like, I had to leave the room. I was, in tears. It was mildly devastating. And Julia, like, she carried on. And I was like, okay, maybe like, I have to self-assess, like, what is how are my reactions or interactions, affecting what I was speaking to before about the long game. So her resilience, or her ability to be able to bounce back from these situations. So that's sort of one area. Another area is like advocacy. Well, I'll mention a little bit about that. So I can remember Julia, again, when she was going to go into kindergarten, the local school district had said, well, there's this older school, it's in your district, where you live, this is the school that she's assigned to, but it didn't have an entrance for Julia to go through the front door. So they had mentioned that she would be able to use the back door to the school. And I, was not okay with this. And I think, I made some quick assessments, and I was like, well, what are we going to do then about, like, fire drills? What's your plan for this? And, quickly got to the fact that there really wasn't a good plan, and there really wasn't any reason that Julia shouldn't be at the accessible school. And I'm using that story because Julia is watching me the whole time that, like, that interaction is happening, and she's hearing me get on the phone with people, and she's hearing me advocate. I think it's also sending a message to her, like, you are worthy. This is not an acceptable choice. And this goes to, for like, her IEP meetings. I started having her come to the meetings around second grade because it was important that she begin to become aware of what her accommodations were, so that if she wasn't receiving them in class, she could say to the teacher, I think this is on my IEP. Is it something like, and honestly, the teachers were appreciative of it, because sometimes it helped facilitate things, make a bit easier. Also, too, with advocating, there were some times where I would show up at the school one time, and Julia was in the office just hanging out with the secretaries, I think having like cookies and tea or something. And I was like, what is going on here? And the school nurse came out, and we had a conversation about, like, Julia was kind of manipulating the system. Like, she was out of class, and she was very small, and had already learned, like, that people were going to bend or give her a little bit. And I instantly was like, oh, this can't happen. So also, like, again, setting the expectation with other adults that your expectation is such, and that's, not helping the child long term. And the last thing I'll say is, this is the hardest one, I think, is be protective while at the same time trusting your child, because so many of these unknowns are for any child, but, like, they assume greater risk for kids with spina bifida. So, like, wanting to go on the rafters with the other kids at the like the local holiday pageant, like, that's a risk. Like, and you sit there, and I can remember saying, like, I was literally holding my breath. Is she gonna fall? What's gonna happen? So having, taking that, trusting yourself, trusting the situation, trusting the adults that are generally have been wonderful throughout our lives, to do this work as a community. Yeah, and it's really hard, but there are things that can help. One of the things I did at medical appointments that was really difficult was to remind myself to not speak as much as was instinctive, because I kept this question in the back of my mind always, like, what would happen if something happened to me? Would Julia be able to take care of herself. So I tried to not, say as little as I could as she got older. And then the providers eventually were really good about interacting and interfacing directly with Julia. And then they would give her books. Like she got a book about Spina Bifida, a book about cathing. And then we also did like some anatomy stuff where like we would look at the spine, basic stuff, nothing. And like she would identify like where her level was. And so I think just helping hand that off as soon as possible. And just a quick little anecdote. It actually was one time Julie was overnight in the hospital. I had gone home to shower before going back in. And she called me and she said, Mom, they almost gave me the wrong medicine, but I knew that was a nebulizer because it's what my sister takes. And I said, oh, okay, like good thing, good, like it's good. She was able to speak up and say, no, that's not mine. It's nothing that would have been catastrophic, but so handing that off as early as you can. Obviously, you're there as a parent, you're still listening, you're processing it underneath the surface, but it was very clear very quickly that Julia was just fully engaged and it helped her a lot. And she developed some beautiful lifelong relationships with her care providers that came out of that too. So thank you for that question.
So I'm going to start by saying I have arguably the best siblings in the world. I love them all to pieces. And as the slide says, they can be very helpful with making sure that, things are set straight even when your sibling has spina bifida, you get chores. Like that's not fair. If one person has to clean the bathroom, like obviously that's not a fun time. But, your sibling, even though they have spina bifida, can help out. So I babysat one of my younger sisters a lot when I first, became sort of late middle school to high school age. And I think that really helped me establish a sense of responsibility, but also just self esteem in a way because, I would have to make sure that I was responsible enough to, get myself off my bus into the house and back out to get her off the bus, which I really enjoyed doing. But I also kind of realized something the other day that I think I sort of talked about briefly with Mom and Andy is that is sort of a thing that sort of helped me build my skills for initiation with a task too, because, you know, that's sort of an immediate, you can't forget to get your sister off the bus. That would be sort of catastrophic in a way. I'm sure there's whatever protocols, but that's not important. So basically, you can't forget to get your sister off the bus. So right away, you have to sort of plug that into your brain to say, okay, you go home, you take off your bag, get a snack, and then go, get your sister off the bus. And so I really liked that, and sort of knowing when to intervene and not. Another funny sort of anecdote that we were talking about the other day was I would babysit my sister, but not be sort of hovery, and she would make potions with all of the soap in the bathroom. And so my mom would keep saying, "Where the heck is all the soap going?" And I was like, "I don't know. I didn't say anything for a while." But, so that sort of thing was really cool because that was sort of our sister thing where, it was harmless, but no one was telling mom where all the soap was going. So I really liked that. But one thing that I really appreciate about them is that they hold me accountable. So this one's a funny one. It says, "Could you get me?" "No, but you can get your own." So I would ask one of my sisters to, get me a snack or something because I was busy doing whatever I was doing and didn't want to get up. And they would always be like, "No, no, I'm not getting you a snack. Like you can get up and get your own. It's gonna take you 2 minutes." And I learned that pretty quickly. And so with the family game nights that we would have, they wouldn't let me win. Like games in our house were so intense. They were down to the last man standing. And I remember that being actually a really good memory because like the competition was fierce and we all had a lot of fun with it, except for the person that lost. But, that was great. The amount of time and effort on school related work would be something that also needed to be equal. Mom always said the grades don't necessarily have to come out the same, but the amount of time and effort that you put into an assignment, sort of had to match up as best it could. We were talking about the other day, I was not good at chemistry and different things, and there were just subjects that were really hard for me. And whether that was spina bifida related or not, I think mom just realized at some point that, there are some things that some people just aren't going to grasp, and that's okay. But as long as you put the amount of effort that, your sisters are putting in, or the amount of effort that you feel is appropriate, then, it is what it is. We'll figure the rest out. And just being reminded that, there are a lot of things, for the amount of things that I could do, or couldn't do, excuse me, there were so many more things that I could do. So even though I had minor setbacks with, school related things every once in a while, there were still a lot of good things that I was capable of accomplishing at that point, and I really appreciated that throughout my life as well. The big heading is, what steps can I take to increase my self-direction? And there's a lot of different ways you can go about this, but the biggest thing that I think is helpful is to take steps to determine and recognize your strengths and weaknesses early on. Because what I found is that when I'm trying to accomplish something, I'm a person that likes to sort of build my weaknesses as much as I can. But if I'm trying to do that to get something accomplished in the moment, it's going to be a lot more difficult than if I'm to just switch gears and use my strengths. So a lot of strengths-based work is important until you're able to sort of isolate your weaknesses outside of a task and work on those separately before incorporating them back into a task, I find really important. And don't necessarily ruminate on your weaknesses, because that's going to be, in the short and possibly long term, detrimental to your self-esteem and your mental health. Certainly not saying don't work on them if that's what you desire to do, and that's what, other people are sort of wanting and willing to help you do. I think that's excellent, but I'm just saying, don't sort of ruminate on them to the point where it's detrimental to you. Don't be afraid to ask for help. Again, that's not unique to spina bifida. So many people need help with so many different things, aspects of their life, that it's not, a big deal at all to say, okay, I'm really stuck on solving this problem. Can you help me? That's totally okay. And use the supports that are put in place to maximize your strengths, again, with sort of either the school or work related things. Don't be afraid to use the supports that, your teachers or your employers are able to put in place to help you be successful. They might be unique to you, but they aren't. And they can be unique to spina bifida as well. But again, that's sort of something that's universal. We all help each other in the workplace or at school. And it's not necessarily just that one thing that's making you successful. So try not to ruminate on, oh, I need extra help. That's totally okay. And a lot of people do. And speak to your provider or someone in your everyday life if you want to, remove a certain support from, whether it be, something from your IEP, you don't feel you need a certain accommodation anymore. So before you completely stop utilizing it, sort of talk to someone and try to think about the implications that's going to have on you, academically or socially or whatever it is, just because I've learned from experience that a lot of these accommodations, if you do try to take them away, they were there for a reason and they were sort of assisting you in that way. So if you pull them out, you might feel fine in the moment while you have them to pull them out, because you don't understand that once they're pulled out, you don't have that support anymore that was helping you be successful. So definitely talk to somebody if you're considering doing anything like that.
Yeah, so, think back, you two, like, back in the old, back in the day where maybe you can relate to this. There's a couple of questions. There's one person that uses the term, what do you do if my child has demand avoidance? I love that term, demand avoidance. There's another person who has brought up, it's just so frustrating that, my daughter says she can't do things when I know that she can. Do you guys have any thoughts on that? Think back to when Julia was a little girl, or Julia, think back when you were a little girl. What would you advise people?
I definitely experienced that with Julia, and one of the tools that I utilized was outsourcing. And what I mean by that is that if Julia would say to me, like, I can't do this, or task avoidance, or all of those sort of those scenarios that you mentioned, I would say to myself, okay, well, let me put that task or that thing in the hands of a really highly qualified third party. Like, I just don't think I'm going to be able to walk that far, mom. Whatever it might have been, or I just really don't want to do that. And then I noticed that if I put her, like, I have a very dear lifelong friend who is nutritionist and a personal trainer. I had friends who were like swimming instructors. I had other people like choral groups that Julia did. And it was quickly apparent that what Julia wouldn't or couldn't, didn't, or, maybe didn't want to do for me, she was eager to demonstrate with like another person. So that showed me like, okay, she walked a 5K when she was, I'm not sure, very small, and it said like last place finishers day's biggest winner in the newspaper. And because and she was like, so just things like that. It's amazing the resistance that they'll give you as the parent. And I think it was maybe it was the psych at the time said to me, that's okay. That means that they trust you and they're on their worst behavior for you. But like what they're doing with other people, that's all good. That will come back. Like you can, keep doing that. Keep pulling in all those other resources that I utilize my parents, my family, like we said, her siblings. So anybody that could take some of that burden off of me, and really like that takes a village. It really took a village, and we made use of it.
Yes, I think kind of coming from another angle, saying that you don't want to or you can't do something is a really great opportunity for a conversation starter with your child or, young adult, just because, you're going to kind of want to dive in and say, okay, well, why do you feel like you can't do that? Or what's the barrier to, sort of being successful in this realm? And I think one of a few things is going to happen. I think first they might not be able to come up with a reason for why they can't do it, and they'll say, "Okay, well maybe I can." Or, it's going to open up a bigger conversation about, well, this takes a lot of planning and a lot of organization, you know, take for example, I think a school project, I remember I remember sort of getting those 2 or 3 weeks in advance and then the night before saying, "Mom, can you go out and buy me poster board? Like this is due tomorrow." And she was like, "What?" So, I think kind of along the lines with those tasks, you kind of have to lay out a couple weeks in advance, like, okay, what are you going to do on the first day that you get the project assigned? Maybe it's as simple as like, okay, you go out and you buy the poster board, like that's taken care of. You don't have to worry about that. So sort of scaffolding the tasks as much as you can. And I think that might even be helpful in the medical space, but also I think one of my big interests is to be able to help people with spina bifida eventually create, books or journals of their experiences with spina bifida so that they have all that information at their fingertips so that, if they do need a surgery or they know what medications they're allergic to, that sort of thing, to be able to help them sort of take those bigger aspects and break them down into smaller chunks.